Hey there, Dr. Luke. What we're going to do today is go through a thoracic segmentation class, but also with some hinge point work as well to really specifically focus on the flexion extension of these areas. It's a really important sign of spinal health that we have segmental control and flexion extension with each segment of our spine. Okay, thoracic cars, breathe in and irradiate. Coming to flexion, rotation, lateral bending, extending. Rotation, lateral bending and flexing. Making sure we're not hinging from the hips. Hips are stable. And we're creating the biggest circle possible. What movement do you have ownership of? That's what we're asking. So just close your eyes, slow and controlled. So 4 reps to your right and 4 to your left. We're just ending that now, coming up into that neutral position. Now we go to the left. Two. 3. And last rep. Really this best rep. This last one, really finding that best possible range. And done. Fantastic. Okay, spinal segmentation on all fours. We want to really focus on moving one segment at a time, starting off in extension and bringing our lumbar spine, our pelvis into posterior pelvic tilt, extending up to the thoracic area, lower thoracic, upper thoracic, now down into the neck, squeezing up, extending from lower lumbar, increasing that up the spine, segment by segment, going up into extension. Great, initiating from lower lumbar. Three. 4. 5. 6. Now to isolate our thoracic spine, let's get onto our knees. Our sit bones will kind of sit on our heels there. Coming up, extending, initiating from that lower lumbar, and then moving our way through lower thoracic, upper thoracic, and flexing down, squeezing up, initiating into extension through our lumbar spine. You'll feel your sit bones coming back. Extending through our thoracic spine. Into flexion. Tucking the tailbone under. And back into extension. Really focus on that thoracic spine as you come up segment by segment. And 2 more here. And last one. Extending segment by segment and up into extension. Very good. Okay, spinal segmentation, focusing on upper thoracic spine, palms facing down. Bring your elbows up against your knees here. Start off in extension, initiating from the lower lumbar into posterior pelvic tilt. And what we want to do here in a flexion is push down with our hands up into our flex position. 1 vertebra at a time and squeeze into that last range. We're coming into anterior pelvic tilt. This is where we want to bring our elbows into our knees and squeezing up into extension. As we come up, we lift our chest, bring our chest out, and we squeeze our elbows into our knees, extending up, going into flexion. Start off that lower lumbar, lower thoracic coming up into upper thoracic, pushing down with our hands so that we can really go into that flexion. Good, extending. Remember, we're pushing our elbows into our knees as we extend and lift and open up that chest. Into extension, going into flexion, posterior pelvic tilt, coming into the lower thoracic area, upper thoracic, squeezing and pushing our hands into the floor, opening up that area of our thoracic spine into flexion, coming into extension now. Pushing our elbows into our knees, extending, opening up our chest, segment by segment. Good, let's give it another 2 reps. Good, last rep, initiating from that lower lumbar. 1 vertebra at a time, pushing our hands down, squeezing up into flexion, and going into extension, pushing our elbows into our knees, extending up. Fantastic. Okay, hinge point work. We're going to work on our lower thoracics here. We're going to place a sock down on our yoga mat, and we're going to then place our thoracic spine, our lower thoracic spine, over that area. We're then going to place a yoga block in between our legs, breathing in and irradiate, and we're feeling and sensing that area of our spine over that sock. And we're now going to initiate from that area, from that segment, pushing into that sock. Only that segment pushing into the sock. Nice and slow and controlled, flexing into that sock and then extending up off that sock at that segment. So really slow and controlled. They're going to be very small movements, and we're going to do this for a minute. So just slow and controlled at your own pace, pushing into that sock and off that sock. You want to initiate just from that area so that we're retraining that segmental control, and we're getting that spatial awareness and control of that individual vertebra moving in flexion and extension. Sometimes these areas haven't been moving very well for many years, and it takes this type of training to start retraining and getting that flexion and extension and control into these areas. Great, that's a minute. So what we want to do is move up the thoracic spine there, mid-thoracic. Maybe place it in a place where you feel you're having problems. And again, we're initiating from that segment, just pushing down into the sock. And like we've got a set of weights that we're trying to lighten the weight at that particular area, we're lifting off the sock. Breathing in and irradiating while we're doing that. And really trying to work that area, really slow and controlled. And working that area. Good. So that was our last one. We can work a little bit longer in there if you wish to, but really important that we start to retrain, get that neuromuscular connections to our nervous system of moving our segments one vertebra at a time. Okay, let's do some more hinge point work using our band. We're going to place the band down to that lower thoracic area. That's the segment we're going to be trying to flexion extend and get that segmental range. On your knees, bringing your hands down into this position, starting off in extension. And we're going to do this for 2 minutes. And so what we want to do is a very slow and controlled way is we want to push the spinous process, initiating the movement right where that band is, bringing it into flexion. And these are really small and subtle movements. Here, coming into extension. Just positioning myself a little bit different. You can move around, see what's comfortable. But flex and extend. We're just trying to initiate the movement from where we're feeling that pressure on the vertebra, on the band there. This helps retrain that flexion extension, that neurological control, so that we have spatial awareness and good mobility and health of our spine. So we've done a minute, another minute, just slow and controlled. Only of that segment. Good, another 15 seconds left, so another rep or so. Fantastic. Now just bringing the band up just a little bit higher. Okay, and now we're going to be focusing through that area now. 2 minutes again, just focusing a little bit further up. So the very small and subtle movements. So close your eyes and just really focus that flexion and extension. Just picture that vertebra moving into flexion and extension. And it's just slow and controlled there. It's a very subtle movement. This is going to help improve our segmentation work so that we're going to get a good, like a Mexican wave of our spine as we're doing our segmentation work. So another 30 seconds or so. Again, just nice and slow and controlled. And last one, that's our 2 minutes. Fantastic. Okay, so with this one, it's our mid-thoracic area. We're going to bring the thoracic band into this position here. Now, we don't want to be doing this movement. We just want to be initiating from our thoracic spine. So we just want to extend and flex. Extend and flex. Good, let's do this for a minute. For this one, it's really difficult to just move our thoracic spine and not our scapula with this one to get the movement. It's really small and subtle movement. Another 30 seconds. Another few reps, 10 seconds to go. Great, fantastic. So that's our hinge point work using a band. Okay, thoracic cars, breathe in and irradiate. Coming to flexion. Rotation. Lateral bending, extending. Rotation, lateral bending and flexing. Making sure we're not hinging from the hips. Hips are stable. And we're creating the biggest circle possible. What movement do you have ownership of? That's what we're asking. So just close your eyes, slow and controlled. So 4 reps to your right and 4 to your left. We're just ending that now, coming up into that neutral position. Now we go to the left. Two. 3, and last rep. Really, this best rep, this last one, really finding that best possible range. And done. Fantastic. So that's how we do a thoracic segmentation, flexion and extension class, really trying to retrain your spine and spinal health.